an issue that Janet's about to bring us now that really affects a lot of women out there, and some
and
men
guys,
too.
You know, a lot of guys are wearing earrings.
Have pierced earrings, yeah.
That's right. And when you look at it, it's kind of it's jarring because it's you know, you're losing part of the lobe. Split ear syndrome is described in medical journals as the gradual splitting of the earlobe leading to complete separation of the lobe, and you can see that part of the lobe is completely gone, or at least split in two, and it could be brought on by wearing earrings that you may develop allergies to. That's one of the problems, you know, because they're made with different types of metals, gold, perhaps mixed with nickel, for example. Now, to find out more about the mystery of the split earlobe, we call on Dr. Timothy M. Greco, a plastic surgeon who's had a lot of experience with patients who've had this particular malady. Hi, Dr. Greco. Thank you for joining us today.
Thank you, Jennifer. Thank you for having me.
Aside from the trauma where an earring is actually pulled off the ear, it would seem that split ear syndrome is caused by an allergic reaction to certain metals in earrings or allergic contact dermatitis, but do you know that for sure?
That is a component of a split earlobe, Janet, and it's a gradual situation that occurs. Patients will sometimes experience weeping or oozing or a dermatitis that occurs in the area of the ear. And a lot of times it's due to the actual piercing, Janet, that it incites the actual allergy to the metal. The best way to test for that is to do a patch test for if the metal is causing the problem. As you mentioned, a lot of times when earrings are made, 24-karat gold earring, the actual stem may be an alloy because 24-karat gold is very malleable and it's soft. You add an extra metal to make it stronger,
right. You can't have 24-karat. It's too soft, as you say.
That's correct.
So there are inherent problems. I know personally I've had that problem where it got very irritated and red and swollen, so common sense told me to take it out of my ear. If I leave it in the ear, for example, would that eventually develop into something more serious like split ear?
Exactly, Janet. That's the mechanism that occurs. It's a constant inflammation that weakens the tissues, and then eventually the earlobe will split. The good news is that what we can do is we can correct the split earlobe with a procedure where we remove the edges of the skin and we can put the ear back together again. Sometimes we'll do what we call a Z-plasty, which is a technique that keeps the natural curvature of the ear and result in a very natural looking ear once again. The key though, and you've mentioned it, Janet, is you got to make sure that the patients are not allergic to the metal that's in their earrings, because if they go back and they start using the earrings again, the problem will recur.
So basically what you tell people is if you want to prevent this syndrome, don't wear earrings because there's metal in every kind of earring, and as we said earlier, you can't go 24-karat. So if you're susceptible to allergic reaction in the ear, are you just best off to stay away from earrings altogether?
Well, I think the key is finding a metal that is compatible with your skin. Titanium, things of that nature. There are other metals out there that are what we refer to as inert, which means they don't react with the tissues of the skin of the ear, that are very well tolerated, and then patients can go back and start wearing earrings again. Another important point too, Jan, is the difference between the split earlobe and the stretched earlobe. We all know of patients that wear heavy earrings where they actually get a stretching of the earlobe. That's a different mechanism. That's due to more of the weight of the earring as opposed to the actual nature of the metal that makes the earring up.
So you can't get split ear syndrome if the earring is heavy?
Most of the time not. The split ear syndrome actually comes from the allergy to the metal.
All right, Dr. Tim Greco, I know that you've got some information on your website regarding split ear syndrome, and I've got an allergy coming on. I don't think it's caused by my earrings, but I'm getting an allergy in my throat right now. Thank you very much. People would like more information, they go to your website, Dr. Greco's website at www.drgrecoface.com. Thank you very much, Dr. Greco.
Thank you.